Hi, my name is Dr. Shane Arnold with the Airrosti Rehab Centers. Today I wanted to talk to you about lateral epicondylitis or tennis elbow, which is the most common reason that people will go to see their medical doctor for elbow pain. It's closely related to pain on the other side of the elbow, which is called medial epicondylitis or golfer's elbow. Actually, lateral epicondylitis is much more prevalent. In fact, you're 5 times more likely to have pain on the outside of your elbow than you are on the inside. So tennis elbow is often caused by overuse or repetitive stress to the tissues. For example, a tennis player, through doing lots of backhands, will stress that tissue to the point where it will start to become injured. Often these injuries are found in athletes, but that's not the only place that we see them. Anyone who does any type of overuse or repetitive stress type of activity can suffer from the same symptoms. For example, somebody who is on a computer a lot and their arm is extended will have stress to that area. A mechanic or a carpenter, anyone who is twisting and turning and using their arms a lot can also be susceptible to the same type of pain. What we see when people have lateral epicondylitis or tennis elbow is often a pain situation. The pain is located at the top of the forearm, at the elbow, on the outside of the elbow. This is where the epicondyle, or a bump in the elbow, is. That bump is significant because all of your wrist extensors attach in that area. Let's go ahead and take a look at the anatomy involved. We're going to use the muscle chart to get a really close look at those tissues. Okay, so in looking at the anatomy, the first thing that we want to start with are the bones of the arm. In the forearm, there's 2 bones right here. They're called the radius and the ulna. Now if we look up above that, right here is a much larger bone. It's called the humerus. And at the bottom of the humerus, on the outside right there, is a little bump. That's the lateral epicondyle. That's where all the muscles of the forearm, the extensors especially, are attaching. So let's take a look at those muscles now. Okay, so when we're talking about the muscles of the forearm, on the front side of the arm are the wrist flexors. They're attaching up here to the medial epicondyle. For our purposes, we're going to focus on the wrist extensors over here. And you'll see there's several different muscles. They are on the back side of the arm and they attach to that lateral epicondyle. For those people who are suffering from lateral epicondylitis, specifically these muscles right here, as they turn from muscle to tendon, that's where a lot of the damage happens, and most of the pain tends to be focused right up in that area. So now that we've looked at the anatomy a little closer, let's talk about what you can do to prevent this from happening. Or if you've got some of that pain starting to show itself, what can you do to help manage that? Because this is an overuse or repetitive stress injury, one of the first things that you should try to do is to back off of that activity. Maybe stop doing it or reduce the amount of stress that you put on those tissues. We'll also recommend that our patients use ice. And our recommendation is that you apply the ice for 20 minutes, then you take it off for 20 minutes, and then you apply it again for 20 more minutes. You have to give yourself at least an hour after that cycle to let the tissues relax and warm up, but you should repeat that cycle 2 to 3 times a day. Additionally, besides rest and ice, we recommend that our patients do active rehab. So there's exercises that you can do that will help you manage this condition. I'm going to introduce you to Dr. Abby Perone, who's our Director of Active Care here at Airrosti, and she'll show you what needs to be done.
Hi, I'm Dr. Abby Perone, and today we're going to discuss how we at Airrosti use active care to manage musculoskeletal injuries. As a general rule, we use the combination of releasing, stretching, and strengthening the tissue in order to heal it quickly. Specifically for lateral epicondylitis, we are going to release the tissue with a lacrosse ball. We're going to stretch the tissue with stretching, and we're going to activate the tissue and strengthen it with a tool called the Thera Flex Bar. Let's go check out how that works. What I have Dr. Arnold doing is sitting here at a position where his shoulder's at a comfortable height. Notice how his arm is not too high or not too low. So we're going to use the lacrosse ball to release and scan the tissue from the wrist to the elbow. And in order to do this, we're going to apply downward pressure with our arm. To increase the pressure, you can use your other hand to also push down on your arm. And during the scanning process, we're spending about 2 minutes on this area. And what Dr. Arnold is doing is looking for a spot that feels tight or tender. Once he finds that spot, he's going to stay there for about 10 to 20 seconds to wait for that tissue to release or loosen. Essentially what we're doing with the lacrosse ball is providing a massage to the area so that the tissue will start to soften. And then you flip to the other side of the arm and you're going to repeat the same thing. Same principles always apply. A little bit of downward pressure and taking the wrist through ranges of motion, stopping and finding a tender spot, and spending about 10 to 20 seconds until you move on to a new area. Now that we've released the tissues with the lacrosse ball, we're going to stretch them. So I'm going to have Dr. Arnold lift his arm up, and he's going to use his opposite hand to create a downward pressure on his hand. So this is stretching the extensors of the wrist, and he's going to feel a stretch through the top side of the arm. If at any time you feel sharp pain or too much stretch in an area, go ahead and release that stretch a little bit so it's milder. And the literature shows that when we're stretching tissue, it's most effective if it's held for 90 seconds. So in this case, we would hold the tissue stretch for 90 seconds. But let's go ahead and flip over to the other side. Again, he's going to pull down on his hand to stretch the front side of his arm, or the flexors of the wrist. And again, we would hold this for 90 seconds. If it feels too intense at any time, release the intensity of the stretch and hold it there. We've released the tissue, we've stretched the tissue, so now let's strengthen the tissue. And we're going to be using a tool called the Thera Flex Bar. So I'm going to have Dr. Arnold hold the Thera Flex Bar with his right arm, the side we've been working on. He's going to extend the wrist back, and then he's going to use his other arm to crank the bar forward to create resistance. Now, going back to the right arm, he's going to slowly let those knuckles come into one line, and when they do, he's going to release the bar. Good. Let's do one more repetition so we can show everyone how to do it. All right, extending back, cranking forward, and then slowly releasing until the knuckles come in one line and release. Perfect. So now I want to talk about what you should be feeling when you're doing this exercise. A lot of times in this area, people think that they will be feeling a deep stretch or an intense burn, but really what you're looking for is just a feeling of warmth to that area. So when doing this exercise, if the elbow feels like it's warming up, that's exactly what you should be feeling. So let's talk about how much we should be doing this exercise. 2 sets of 10 is what we recommend, and 1 to 2 times a day, depending on what your Airrosti provider suggested. And if there is any time where you feel any discomfort doing this exercise, go ahead and contact your Airrosti provider so that they can scale your sets and reps. Let's review what we've done today. So we released the tissue with the lacrosse ball, we stretched the tissue, and then we strengthened the tissue with a Thera Flex Bar. And if you are wanting to look for a Thera Flex Bar to do this exercise at home, it's easily found on a search online.
Okay, so what do we do if your self-management efforts aren't paying off? If that pain isn't starting to reduce, in fact, sometimes it's even increasing. Traditionally, people will go see a physical therapist or they'll go see their chiropractor. Often they'll also go see a medical doctor. That's the most common place that people turn. Your medical doctor may give you a pain reliever, an anti-inflammatory or a muscle relaxer, but the most common treatment for lateral epicondylitis is actually a cortisone injection. I wanted to talk about that really briefly because there's been recent research that has shown that that is not the most effective thing. In fact, it can actually be detrimental to you. In the Journal of the American Medical Association recently, there was an article that talked about using a cortisone injection versus a placebo. In those that used the cortisone injection, they had resolution of their injury within a year, 83% of the time. Those that used the placebo had resolution within a year, 96% of the time. So in reality, the placebo had better effect than the cortisone injection. More disturbing though is the reoccurrence rate. In those that received the placebo, they had a reoccurrence rate of 12%. Those that used the cortisone injection had a reoccurrence rate of almost 50%. So what we find is that even though that is typically the common way to treat this injury, it's really not the most effective. Now the interesting thing about lateral epicondylitis is it's what's called a self-limiting injury. That means it's going to go away on its own eventually. Most often that's because the injury gets painful enough that you stop the activity that's causing that stress. Usually, lateral epicondylitis goes away within about a year, but it can on occasion take up to 3 years. Here at Airrosti, we want to take a little bit of a quicker approach. We follow current medical guidelines for fixing musculoskeletal injuries. And with that, what we do is we apply a very specific manual therapy to the soft tissues. We combine that with the active rehab that Dr. Perone just went through, and we get really fantastic results. In fact, we keep track of all of those results. In 2012 and 2013, we treated almost 22,000 extremity cases, all extremities. And what we found is that 89% of those had complete resolution in an average of 3.3 visits. So typically it takes around 2 weeks to resolve this type of injury. Now, if you're currently suffering from lateral epicondylitis and you've tried some of the things that we've gone over today, I suggest that you call our 1-800 number or go to our website and let our professionals help you get scheduled. We'll be able to take care of you quickly and efficiently and get you on the path to recovery.